If you are someone who loves a good all-you-can-eat buffet and enjoys having plenty of options, I found the perfect ceramic implant system for you. One brand and 4 different ceramic implants, 1-piece, 2-piece, bone level, tissue level, and a plethora of different abutments and parts. This system has it all. Hi, my name is Dr. Tobias Steinherr. As a specialist in ceramic implants and metal-free dentistry, I teach you the dental skills, the biological concepts, and the practical implementation of ceramic implants in your practice to increase your revenue and decrease your stress while creating healthier smiles for healthier patients. If you're interested in ceramic implants and biological dentistry, this is the perfect channel for you. I release new videos on these topics every week. So if you haven't already, make sure to subscribe. And if you like this video, then give it a thumbs up and smash that like button. We are back in Switzerland. Again, Z5m, like most of the ceramic implant systems we've discussed already, is based in Switzerland. And just like Swiss cheese, this implant offers a wide variety to choose from. The Z5m is a monotype 1-piece implant available in both parallel and tapered designs. Since you can prep the implant, you get an ideal biological solution for immediate and delayed implants with 3.64 and 5 millimeters diameter, as well as 3 lengths, 8, 10, and 12 millimeters. You have all the standard sizes to choose from. Although some of you might miss a 14 millimeter length, at least for the tapered 4 millimeter diameter. But maybe someone from Z5m is watching this video. If you prefer 2-piece implants, you also have 2 different variations. A more tissue-level design implant, the Z5TL, and a true bone-level implant, which is surprisingly called the Z5BL. So no confusion here. What you see is what you get. Let's start with the tissue-level implant. As its design is as simple as the name, you get 3 lengths, 8, 10, and 12 millimeters, but only the 2 larger diameters, 4 and 5 millimeters. That's most likely for stability reasons, as a smaller diameter implant with an abutment interface would be more prone to fractures, of course. Like with SDS, their small 3.3 millimeter implant is also available as a 1-piece implant only. SDS is also the system you could compare the Z5TL to the most, as Z5m offers 2 straight and 2 angulated abutments for cemented crown and bridge work. In addition, they offer 3 different straight and angulated Z-lock abutments to fix removable locator-based dentures. The option with the angulated locator abutment is unique compared to all other ceramic implants. As with SDS, the crown will be placed on top of the implant shoulder with the abutment in the center. So there will be only 1 margin between the crown and the implant shoulder and no hollow gaps between screw-connected non-cemented zirconia parts. The main difference from SDS is that you are not allowed to prep the implant shoulder. So you have to place it deep enough to hide the implant shoulder and will therefore have to deal with a subgingival crown margin. That's also why you have to use an impression post or a scan body to transfer the intraoral situation into a digital or analog cast model. We will talk about the 2 different kinds of screws they use in a second when we discuss the Z5BL, the bone level implant that Z5m also offers as a 2-piece implant variation in their lineup, because they claim to have the first 100% 2-piece ceramic implant that's entirely made of zirconia, the implant, the abutment, and the screw. They also offer a titanium screw for their tissue level and bone level implants, but let's talk a bit more about the zirconia screw, because this feature might in fact be a weak point and a risk for the long-term stability of your restoration. If we recap the material properties of zirconia, we know that it's extremely stable under compressive forces, but it's also a brittle material when it comes to mechanical stresses like tensile, shear, or bending loads, as well as stress peaks in the thread tips or over-tightening beyond the recommended torque, since those screws are very thin structures. And one of the main tasks of an abutment screw is to anchor the abutment in the implant body, but the lack of elasticity makes it challenging to achieve reliable preload forces. So while the idea of having a completely metal-free solution in an implant that's made 100% from zirconia might be great for patient marketing, As a dental professional with a lot of experience in ceramic implantology, I personally remain quite skeptical and would rather wait for some more long-term data. And there's a second thing I find worth thinking about when it comes to stability and material properties. You get a large variety of different abutments for your bone level implants, and they all have one thing in common: the rather thin neck that is inserted into the implant. This is the area where peak forces occur under dynamic loading and where the full zirconia abutments used for titanium bone level implants already failed in significant numbers in the past. This fact, in combination with a brittle zirconia screw, doesn't sound too promising, to be honest, but maybe and hopefully Z5 will prove me wrong over time. And a second thought I want to share on zirconia bone level implants is the following. One of the main reasons for bone level implants has been the fact that titanium is problematic when it comes to aesthetic and visible titanium surfaces. Therefore, hiding the titanium inside the bone and using different prefabricated or fully customized titanium and ceramic abutments to adapt to the individual soft tissue thickness was a logical step in the development and evolution of titanium implants. But with zirconia implants and the ability to even prep the implant itself, so not with all but some of the available systems, the main reasons to use bone level implants in the first place have actually disappeared, in my opinion. So using bone level zirconia implants somehow serves more as an end in itself. There might be situations where zirconia bone level implants are absolutely justified and appropriate, but in general there are better options when using zirconia as an implant material to maximize the biological and the aesthetic benefits. Of course, it is an option to convince dentists who don't want to change their routines to make the switch to zirconia instead of titanium, but again, it's always about achieving the best possible result for our patients and not about the most comfortable and lazy way for us as dentists. So even if I step on some people's toes with this frank opinion, it's a point worth discussing further. So again, if you are a Z5 user or from the company itself, feel free to reach out to me in the comments below. I would love to discuss this special topic further. To sum it up, Z5 definitely offers the widest range of different implant options. Their one-piece implants offer a highly biological solution, as you can prep the implant shoulder like with SDS or Ceraroot. With their two-piece implants, you can choose between a tissue-level version, which has to be placed subgingivally since you can't prep it, but at least it doesn't cause a biological weak point within the biological width, as the crown is cemented right on top onto the implant shoulder. The bone-level zirconia implant is a great choice for dentists accustomed to bone-level titanium implants in their daily routine, but it might not be the ideal choice if you're looking for the best biological and most stable outcome, as questions about the fracture resistance of the zirconia abutments and especially the zirconia screw can only be answered over time. So, what is your opinion about the zirconia screw connection? Is it a great idea or a questionable marketing move? Post your thoughts in the comments below and like the video if you like the video. So see you next time, and until then, don't forget, if we can do better, we should do better.